Good afternoon, everybody. It is 13:40, and we are going to make a start. So if you could all take your seats, please. I'd like to introduce our first speaker this afternoon. It is Christian Lunetta. Thank you.
Good afternoon, and I want to thank the organizers for this opportunity to be here and to discuss about the experience that ISLA developed in these last 10 years in this for the advanced care planning. And I want to start with the end of the history. At the end of the history is these big results that we obtained in our country about the advanced care plan. The first law that is devoted to put the rules about to manage the advanced care planning, about the some aspects that I will show you in this presentation very briefly. And the first was, for the first time in an Italian law, we have the concept of an advanced directive of treatment. As you know, it's an important instrument, in particular when we are involved in the care of severe disease. And I want to emphasize the concept of these articles. Yes, the first was the right of the patient to decide to consent or refusal to perform diagnostic tests or therapeutic choices, but also the importance to define and trust that would be important when the patient is unable to communicate or to be in relationship with the other. And the other aspect was, for the first time, the creation of a specific registry in all the Italian region that are collecting these documents coming from different patients, not only ALS patients. And for this, this good history was important for us because as an association we believe that a good advanced care planning it's important, as we saw in this year, for example, in experience in other countries such as Australia, UK, or Canada and US. And you will know that there are a lot of advantages to use these instruments in the management of chronic diseases such as ALS, because there is a reduction of the stress in the health professional. There is the reduction of the case of litigation related to the medical responsibility, a reduction of the rate of hospitalization in most of cases, because the hospitalization should be planned during the disease course of the disease, an improvement of the appropriateness and decrease of the health expenditure, improvement of quality of care, and increase of there are different studies that emphasize the role of a good advanced care planning in possible increment of the life expectancy related to the chronic disease. Another important article was for the shared care planning, and I want to underline that this law established that this declaration, it's important that could be recorded, but we can use written form, we can use video recording, or we can use devices that allow to the patient to declare the will about the treatment, about the procedure. And this is it's very important because a positive result after a long history of interaction with government to emphasize what is important for us to use for example, ACC devices to obtain this declaration. Another part of this law is the emphasis that the law put on the time, in particular the time of communication. In the law is very well explained that the time of communication between the health professional and the patient is a big part of the care. And for this, it's important even in the planning of our activity as a professional to include this part of the activity. In fact, for this, we emphasize this concept because the time, most of us spend a lot of time to discuss with the patient, with their family members about the disease, about the choices. It's important to put this aspect in the right position. But as I discussed before, this is the end of history. We started to obtain this law in some years ago, after some patient that claimed in the newspaper the right to declare the choice of the treatment, and if the treatment in a specific model could be stopped if the treatment is not considered useful for the quality of life, for the health, and for their dignity. And for this we performed a very interesting work inside the association to collect some concept that was included in a document. The document was provided in all the region by our chapters. The document includes the concept about as discussed before, the communication is a process. It's a process between, patient, family member, and health professional. But it's important that the patient could have the ability to decide what is the right flow of information. There are patients that, want to be informed about all the detail of the disease, but there is the right to reduce this flow information if the patient is not available to know in this moment, in that moment, all the details. And the other concept introduced in the document was the idea of the time is important to increase the knowledge of the patient, of the family member, but also of a lot of health care that, for example, for the first time could meet the patients in their activity. Other concepts that were included in the document that are now in the law, now this law, was the concept of the proportion between a treatment and what we can obtain from the treatment. And for this, it's important that patient, the duty of the health professional to inform, but it's important the right of the patient to decide which treatment could be accepted or not accepted. And this document was important because thanks to this, we included in the document also 4 examples of document, of forms that could help the patient to well define, well declare the decision. Recently, these forms were updated with the, obviously with the law that was approved after the first version of these forms, and the forms are for the consent to invasive ventilation or descent to invasive ventilation, or to establish when, for example, is the time to stop the invasive ventilation, or if the patient decided to stop the invasive ventilation when the patient reached the, for example, locked-in status. This is briefly the structure of, for example, of the first document. The second one about the descent of an invasive ventilation, with the part in which is well defined the awareness of some information, and at the end the declaration of the patient. The same for the stop of the invasive ventilation, and the same for this one. And so this discussion want to emphasize that it was important for us, first of all, to clarify some aspect even inside the health professional, because for this aspect, in some cases the health professional not are generally well informed, and for this, thanks to this, we emphasize the rule of the advanced care planning, the concept of the awareness, the concept that there is a difference between an advanced care planning and the concept of euthanasia, the rule of the fiduciary representative, also trustee, and the concept about that could be the time that his patient could refuse or stop what we decided before. And but this history included also not only document, not only paper, but also an activity that we performed in all the Italian region to discuss about this aspect. In particular, we developed in this 4-year 64 training course involving health professionals. And this is the number of the professionals that participate to this training course, and the location of the course. We recently performed a survey including these professionals to understand how was the feeling after the training course, and the result was very interesting because first of all, the majority of them declared that the training course allowed to increase the awareness about the advanced care planning, the importance of that advanced care planning. For the first time, they was were discussed the importance of the time that all the professionals spent to talk, to discuss with the patient and family member. Another result of this survey was that thanks to this work, changed the idea of regarding the advanced plan candidates. I think it was one of the most good results. Few of the health professionals used the document that we prepared to declare the 4 documents, but this is in contrast with another aspect. We received a lot of requests by the patient directly that used the document to define and to communicate the advanced care planning. Another other two results was, yes, in the case in which the professional were used the document, the feeling was positive of this of the utility of the document, but the majority asked to continue this work to implement the knowledge about the advanced care planning. Thank you for your attention.
Thank you. Brilliant timing. Any questions for Christian at all? I have one question. You talked about doing training with professionals in the use of this document. Can you tell us a bit more about that? What kind of methods did you use in that training?
Yes, generally this training course included 2 days. 1 day generally for a frontal in which frontal teaching, in which there is the clarification about some concept about the advanced care planning, but the second day is performing in some cases with exercise example in to understand how is the best way to develop an advanced care planning. But was very interesting because in some region there was a very active role of the patient that were involved in the training course to not to learn but to teach and to have the time to discuss with the health professional about very pragmatical aspect of this, and I was very interested because even the speaker were very happy after the training course, because it was a good experience and increased our this concept for us is as a priority.
Okay, thank you. We have a question just over to the left. Thank you.
Thank you very much. My name's Joan Murphy. I'm a speech and language therapist and I'm a consultant with Talking Mats. And I'd just like to ask if you provide some kind of visual help to people, visual images, pictures, symbols, to help explain the whole process of ACP for people, because quite often the text in documents is a bit dense, a bit heavy for people.
Absolutely, absolutely, because in most of cases are it's not simple to explain some aspect of this process. Firstly, because generally we start to discuss when the patient is not in the last stage of disease. And for this, it's important to help the patient even with a picture or even with a graph to understand some detail that could help the patient and the family member to define a possible care plan. In fact, the concept of the time, yes, is not the time that we spend only to discuss, but the time to repeat the discussion, and in some cases it's not simple. In my experience, there are some cases in which there are a lot of meeting to define this declaration, and for this it's important to start very early. Yes, taking account the importance of the details, but the use of instruments to help the learning, it could be very useful.
Okay, thank you. Okay, thank you very much for your presentation. I think we'll move on. Thank you.